Welcome back to Senior Savvy Cannabis. I'm Catherine Goldberg. Today, we're lucky to have this conversation with Dr. Benjamin Caplan. Dr. Caplan, I don't know if you know this, but I actually read a quote that you had given to Fox News a couple years ago, and that's what got me interested in cannabis for seniors, and that's exactly why I started Senior Savvy Cannabis. So, literally, your quote about this Commonwealth group was literally the beginning of everything. So thank you. I know my readers, all 40,000 of them are grateful for this conversation. So thank you for being here.
I'm speechless. I'm really honored. Thank you. Yeah, I mean, it took my breath away. The sort of inspiration, of course, for me as a clinician is that I reach people and I help people see things in a healthier way, or a way that's a little bit different than what they might have been experiencing. So that's like mission accomplished.
Mission accomplished. You can sleep well at night knowing that you're doing good. So I know you help all types of people. Many of our readers actually have visited your clinic to begin their cannabis journey. Why seniors? What was the interest in seniors? What have you noticed? Why have you gone so hard on this?
Yeah. I mean, there are a lot of ways to answer that. I think the most clear and present is that seniors have the least F's to give about what's wrong with our culture. They've lived hard lives, they've lived through the baloney, and they see through a lot of the lies. And all of us really have grown up with complete misunderstanding about the endocannabinoid system. And this, of course, for those who may not know, is a basic system that we're all born with. It's common across the animal kingdom. And it so happens that as we all age, it wanes. It gets broken in some cases. And so seniors are the ones who are dealing the heaviest burden. They tend to be the most fragile. And as I said, they tend to be the ones that are open to busting familiar lines. And seeking what's better. So for some of the seniors I see, it's really me following them. They led the course, teaching me that this was helping them in the first place.
Is it helping in terms of, is it quality of life? Is it ailment specific? What do you hear the most of? Is it that people are they have arthritis, they have pain, they have sleep issues, or is it even more than that?
Interestingly, the issues that people seem to find benefit with cannabis are almost universal, whether it's children or adults or seniors. And those top three are generally chronic pain, anxiety, depression, and sleeplessness.
What is the biggest obstacle for seniors? Is it that there's stigma? Is it that they don't know where to start? You mentioned that they have zero F's to give at this point because they just want to live pain-free if it's at all possible. But I forget, it's not like every senior has cannabis in their medicine cabinet for when they can't sleep or for when they're in pain. What's the biggest obstacle? And is there still a stigma even in Boston among seniors?
So the biggest obstacle, I think, for seniors is often financial, actually. That, we live in a country where the US government covers the bill for insurance for seniors. And when medicines like cannabis aren't covered by Medicare, that means it's coming out of their pocket. And, dispensaries are businesses trying to make money. They're in the realm of healthcare and they seem like they're, quote, medical clinics, but really their business is trying to make ends meet, and they charge people the most that they can in order to make money. And of course, seniors who don't have work anymore, maybe, most of them are retired, that out-of-pocket cost is not insignificant. So oftentimes they're limited with what they can purchase. And they're also generally undirected in the culture. I mean, of course, my patients have resources that I share with them and have guidance that I'm giving them, but I only see a fraction of the seniors that are out there, a tiny fraction. And those seniors are looking at, news reports or bud tender advice. Thankfully they have resources like you, who are giving them guidance and showing them what's available. But those are the lucky ones. So money is a big obstacle. But really, a lot of them, by hook or crook, get where they need to be. That's the amazing thing about the endocannabinoid system, about cannabis lifting this decline in endocannabinoid tone, is that almost despite experimentation and failures, seniors will still find success. They'll still stumble upon products that over time will help them, even if in the moment they're not working, for that night of sleep or for that amount of pain. As these compounds build up in our system, they work over time.
I always appreciate the seniors who are willing to experiment and to try different products, different cannabinoids, different ratios of terpenes to figure out what works best. Because it's not, I wish it was a one size fits all, but
Mm-hmm.
that's obviously not the case. So before we get into how on earth you got Medicare to help cover the cost of cannabis, because that's mind blowing. And that's what I want to get into. Have you found, I know that part of the Commonwealth Project is really into finding specific care protocols for
Mm-hmm.
seniors, because we don't want a senior necessarily like dabbing out their first time and then, having all these issues. Have you found that there are certain, whether they're products or brands or things like that, are there products that seem to the seniors tend to gravitate towards more? Are they more of the one-to-one? Are they more balanced? Or is it just, what, they'll try anything that works?
So the products that seniors tend to gravitate towards, in terms of form factors or formulations, are different than the products in terms of the constituents and the cannabinoid or terpene ratios. The ingredients are different than the formulation. Interesting. There's sort of two groups of or maybe three groups of seniors. One group is just totally naive. They have no idea. They're kind of new to it all. Then there's a group that's more comfortable but less familiar. Maybe they've tried CBD, or they had a friend's gummy or something. And then there's a group that's very experienced. Maybe they grew up, in the height of the 60s, or didn't care and grew up earlier. The naive patients tend to avoid things which are inhaled. They tend to avoid things which are higher THC. The more comfortable group tends to do what most adults in the country do, which is sort of 5 milligram gummies. There's a growing cohort of interest in beverages. The middle group also is sort of comfortable with smoking once in a while. They know it's bad, but maybe they feel rebellious, or they just enjoy it. Tincture is also common in that group. It sort of seems more medical to some people than, the candy formulations or the chocolate. And then the third group, the people that are most experienced, those tend to be really dedicated smokers. On the one hand, they have lived a hard life. They're often in sort of, terrible pain or mental health struggles or, whatever. But that third group generally has been through an experience when they were younger where cannabis worked for them, in a pleasant way. They have fond memories. They have an affiliation, a connection with smoking. And the interesting predicament for me as a clinician is, of course, on the one hand, I want them to be healthy, and smoking anything is probably the least healthy way to consume it, because you get all this particulate matter and combustion matter. The reality is that the data on cancer, which is, of course, on all our minds, is not so strong. We don't see people with smoked cannabis getting cancer any differently than the average Jane and Joe. We we see, of course, nicotine is a completely different beast, but cannabinoid products that are smoked don't have significantly increased rates of cancer. They do have things like bronchitis and particulate matter, dust and ash and tar that gets into the breathing passages, and of course that's irritating. But it's not the same level of fear and medical worry that cancer would be. So that third group likes their smoke. They do well with it. They're happier. And honestly, I know that group. I know when they walk in my office because they're always smiling. They're always kind of ear to ear, happy and content with their life. They're a little bit like, the world might be burning down, but they're still happy with their world. And there's something really inspirational about that level of happiness that they've been able to wrap their arms around. That's really, really inspiring. And so I don't want to take that smoke, of course, away from them. That's not my job as a doctor. But I try to gently encourage them to try other forms that might be a little bit healthier, longer lasting. And maybe the mixture does a little bit better, but doesn't take away their smiles.
I so appreciate that. Amazing. And this is really, I think, the blessing of cannabis is that it allows us to live our most authentic lives in the least amount of pain, in the least amount of anxiety, so that we can show up, so that we can participate. Because I'm sure these people, like when you're in pain, you're just not pleasant to be around. You don't want to be around people. And if it just takes a couple puffs off a joint to lift this burden, that's the blessing here.
Yeah.
Last question before we get into how the government supported your mission. Amazing. A problem that we have in California a lot is that since it's gone recreational, our medical program was phenomenal, but now we're kind of in this crisis mode, is that people will find products that work for them. And then they use the product, they get relief, they come back 2 weeks later, it's not there anymore. It's never coming back. Is that a problem in Massachusetts as well? Are people able to generally find the products? Is this something that you hear about, or is this kind of only a California problem?
No, consistency is one of the Achilles heels of the whole industry. And that's true not just East Coast, West Coast, but in other countries as well. Some areas in South America have gotten it better. Australia still struggles with it. Germany still struggles with it. Now cannabis is sort of a global scene, but South America, different than our system, has a quote unquote pharmaceutical grade, which is sort of really meticulously overseen high purity products as opposed to a sort of recreational product. And, in the US, we don't have a uniform regulation system. So stores aren't mandated to only produce one product or only grow certain plants. It's sort of a free market. Companies and stores can grow whatever they want, and whoever happens to buy it buys it. So in that natural free market here, some plants grow better in the summer and some plants grow better in the winter. Even if it's indoors, sometimes those plants just, don't want to grow. So the companies, to some extent, follow the organic leader. And in some cases, they're really following their bottom line. And if the public seems to want Blue Dream, this month, they're going to try to produce that and sell that so they can make money. And the interesting kind of catch-22 is people who love any particular strain of cannabis almost innately stop enjoying that. We habituate to products, things that we try and love, we'll take over and over, and actually we stop enjoying them so much. That's a natural phenomenon that happens, whether it's a big bag of candy that you stop liking or a warm shower that isn't warm enough and you have to keep cranking it hotter. That's a part of human existence, is that habituation, that tolerance. So it's a difficult new ballgame for stores that are trying to be medical, but also trying to be businesses. And really, we haven't had a medicine like cannabis. We haven't had anything where people had the choice to buy whatever they wanted. It wasn't a doctor kind of sending a script out and you had to follow what they were sending you. We also haven't had pharmacies that weren't required to carry a prescription. that the pharmacy can sort of do what they want. So it's a peculiar reality that's very new in a worldwide industry. Keep in mind, it's important for people to remember. We didn't know that humans had an endocannabinoid system before 1990. I mean, this is 35 years old. It's really, really new.
Wow. Um, it's always important to bring gratitude back into it. Especially I've noticed when I start to complain about the current state of the industry, the fact that we have access to clean cannabis is a blessing. It's not perfect. It's not perfect anywhere, but I know that my life has been improved significantly because I have access to this plant. So the more we can push that forward, the better. So the majority of the seniors who comment on my videos say that they're on a fixed income
Mhm.
and that the dispensaries are charging an arm and a leg. And some of the products that are Delta 9, THCA, are they don't really know what to do about that. And let's talk about Medicaid and Medicare. How can you tell us how you got the idea to even approach this governing body and where it sits right now? Are any of your patients not paying full price for cannabis?
I have had patients where their medical visits, which can be expensive, are covered by Medicare and by the state healthcare. There are, I think, 7 states where workers' comp will cover cannabis um, products in addition to cannabis care. So like the governments around the U.S. are figuring it out. They're starting to see where they can save money. Medicare today spends $50 billion every year on dementia care alone. And then on top of that, we have things like insomnia, chronic pain management, arthritis. Many seniors are on multiple medications, so polypharmacy is an issue. All of these things have cost, and seniors, spend time not only at the doctor's office, but sometimes go into the emergency room. All of these are associated with severe costs. And if the government is spending a crazy amount of money supporting seniors in this country, they have a financial responsibility, a fiduciary responsibility to taxpayers. They have a burden of care for older adults because they're responsible for the health care of these individuals. There's a large check being paid by someone, by a group that is responsible. They have a lot to gain by doing it better, by being more efficient, by being a better care organization, by serving people the way people want to be served. I don't know too many seniors that are really happy about having a mouthful of pills every day. They feel less human. They don't want to experience life that way, the way they saw their grandparents, at the end of their lives. So, if the alternative could be instead they're, having a joint with their partner or going for a walk around the block and enjoying, the walk and feeling better about their body and the way they're feeling. What person in their right mind wouldn't prefer that? So it's a constellation of safety as a product. And we know cannabis is safe from millennia of human experience, but we know from trials now too. So a safe product, people aren't going to overdose on it. They can get good symptom relief, whether it's any of the disorders that, we've talked about. So if it's safe, it's effective, and it's accessible, what's the government doing? Like, what's the argument not to do this? Except that the army of clinicians out there are just clueless. None of us were taught about the endocannabinoid system in school. It's very hard for specialists to maintain their specialty, their expertise, and learn this whole new physiologic system that we just didn't know was there. This is a pretty big challenge for the professional community too. So it's an interesting puzzle, and certainly fun for me to try to play a part in sharing knowledge.
What some seniors have said that they would love to be able to bring up cannabis to their physician, but they're scared.
Hmm.
they don't know how to have this conversation. And it's not
Hmm.
only seniors. The second group I see this most with is parents of children with severe autism. They say,
Hmm.
if I could just talk to my neurologist, my physician, and say, do you think this could help? But they say they don't even know where to begin the conversation. So
Yeah.
therefore, they don't have it. What
Yeah.
would you tell that group, either seniors or parents, um, that might help them ease into it, that they might feel a little bit more confident that it's not like the doctor's going to be like, hey, stand by, I'm going to call 911 and have you
Right.
arrested. But they feel as if that's going to happen.
Right.
So what would you say to them?
It's funny. I hate anybody who self promotes. So hear this with a grain of salt. But I'm trying to find what the troubles are for seniors and for everybody, and I try to write about them and give kind of playbook recommendations. On my website, actually, there's a whole page that's all about how to talk to your doctor about weed. And on that page, basically, what I talk about is, first of all, you have to prepare. You have to know what you're talking about, understand what you want to convey. The doctor probably, if they know anything, is going to imagine that you want to smoke, and if you don't want to smoke, and they don't want you to smoke, you can sort of clear that up right away. So just thinking through what you want to say first. Of course, knowing who you're talking to. Some doctors are very curious and happy and sort of eager to have a conversation. Some are sort of it's my way or the highway. Some are like, show me the papers. I want to see things that are by the book. So I think addressing the doctor in the way that they are is going to meet success, more easily. But I think ultimately patients have to remind doctors sometimes that the doctor's job is to be there for the patient. Um, and it's sort of sad to say we need to be reminded, but we're human too. And doctors will hear a phrase like, "Hey, I'm interested in exploring cannabis for me. Is that something you can help me with?" And sort of giving the doctor an out, which is, I don't feel comfortable with that, is okay. I mean, we're not trying to threaten the doctor. We want someone who's going to help us. The sad reality, Catherine, is there aren't a lot of doctors who are available to help. Um, I know the community pretty well, and there are a lot of doctors who specialize, in cannabis, but that to them means they give a card out saying you can go talk to a bud tender and get your weed, and that's not really the kind of care I think anybody deserves. But we don't have a medical school establishment. We don't have a residency in cannabis. There's no fellowship. There's no way for doctors to get clinical experience where they're learning from patients, they're following patients over time, they're seeing how people do. Sort of that's how doctors really learn, is experientially. Those forms of education don't exist. I'm in this position with a lot of experience because I took it on myself to open up clinics, to start businesses where I was engaging with patients and learning from them and asking questions. And I've been, fully ostracized, along the way for that.
By other
I
physicians, by other doctors, by the medical profession?
totally, totally, yeah. I've had quote unquote interventions. Like, are you okay? Do you need like something? Like, do you need help? Like people
No
now are
way.
pretty judgmental. Oh, totally. Not anymore. The conversation is fully changed. Everybody's like, wait a minute, how can I get involved now? But before, at the beginning, yeah, people would give me side eye all the time.
Unreal.
Yeah.
Unreal. Thank you for and I interviewed Dr. Mockbook in Texas, the neurologist,
Mhm.
and he said that he's presenting his research in Singapore. And I
Mhm.
was just like, oh dear Lord, like be careful,
Yeah.
so you guys just are taking these risks so that we can all benefit.
Mhm.
Um, just to end on a prediction, um, it's a very new space. If
Mhm.
everything went kind of like according to your dream plan
Mhm.
and cannabis really developed the way that it to its full potential in the United States,
Mhm.
what would that look like? What would this conversation be in 10 years? Would we be growing it in places where it grows really well and being able to ship it to places where it doesn't grow well? um is it that we need to kind of get rid of bud tenders, or is do you think the medical and the recreational are going to take a little bit of like a detour from each other? What do you, in a perfect world?
Yeah, just a small question that has a simple answer, huh? I mean, it's really there's so much to sort of so many threads to pull on there. Um, the army of clinicians that we have, as I was just saying, is sort of not up to task yet. I think if we're going to have a country, a world that's engaged with cannabis, the solution has to be digital. Um, and what I mean by that is, seniors, of course, are not super interested in digital therapies, but their clinicians who may not have training in cannabis will need to be able to deliver state-of-the-art, evidence-based care instantly without having gone to medical school or done a residency or trained about it. So that means, in my eyes, they're going to have a solution which is digital to interact with to give the patients the care they need, they deserve. There's also going to need to be monitoring at home, which is how are these products working? Are people, getting off of their other medicines? Are they getting off of opiates because the cannabis is working instead? That is currently possible today. I mean, I helped build a company that does that. Um, we we need to get technology like that out there, um, but it can't be a one size fits all because everybody's a little different. Somebody might prefer to talk to an Alexa and have that be the way that they're reporting how their medicine is working, as opposed to writing down or on a computer. Someone else might just prefer the old-fashioned way. They want to just talk to their doctor and have their doctor tell them what to do. So I think the digital solution is at the heart of all of this. But we also can't have a totally new system which is just cannabis. It has to integrate with what we have had and have been using for generations. So in my world, that means the digital solutions have to translate using language that the rest of the world already uses. Insurance companies are going to have to start covering cannabis, but they need to know what codes the doctor should give them. And, all of these things, the old system has to be brought in with the new. So I'm working on a few solutions that try to do that. That's part of what I do, apart from my clinic. But I think we also have a information and education gap that has to be solved. And that's partly what you're doing. That's partly what I do. And that's actually all of the listeners out there. If they know someone who's suffering, they should reach out and say, hey, what do you think about cannabis? Have you thought about how that might be helpful? We all need to depend on each other in the ways that we can to serve our fellow men and women. This shouldn't be, we wait for the professionals to do it because, of course, they haven't done it. It needs to come from the people. I mean, that's really what cannabis is and has been. That's the claim to fame. This industry wouldn't be here against every possible law against it if it weren't for people rising up and supporting each other and making this, something that humanity wanted.
Absolutely. And just thank you for your incredible work. And I imagine that these people who come into your clinic, smiling ear to ear, their friends probably say, hey, what are you on? What's the deal? Can I have some? So I
Right.
think this word of mouth is always the best way to spread anything. So I know that the more we spread it, the exponentially it'll grow. And this digital solution is absolutely fascinating. So I know you're going on tour very soon. We're going to link to your blog and your book because they're fabulous. I love how you write, just your use of language and the analogies you use. And they always make me laugh.
Oh, thank
So
you.
I think it's absolutely fabulous. And hopefully we can maybe have another conversation like at the end of the summer and get deeper into these solutions,
Of
or
course.
help people kind of in the Boston area find you. Um,
Yeah.
but thank you for everything you're doing, and it's been an absolute honor to speak with you. I've been wanting to do this in September, so it's really an absolute pleasure.
Awesome. Yeah, thank you. For those who are listening this long, I'll leave them with a teaser, which is something that has not been announced yet, will not be announced here, but I can tease that my team and I have had more progress than any other group ever, and we envision very big things, very amazing things coming pretty soon.
Brilliant, brilliant. And it's just this is the whole, I think the whole point of like the human experience, like help others, live in less pain, live an authentic life. It's not that hard.